My name is Bailey Conkey, and my group members are Sarah Erlinghauser, Sean Ruppel, and Wilmer Gonzalez. We are from Alpha Zeta Omega Pharmaceutical Fraternity, and today we're going to be presenting about pancreatic cancer. We would like to thank Dr. Holly for precepting.
Before we discuss pancreatic cancer, it is important to discuss the pancreas and its role and function in the body. The pancreas is an organ that sits behind the stomach and is about 6 inches long in adults. If you look at the diagram to the right, you can see the pancreas's location relative to other organs in our body, including the liver, gallbladder, and the intestine. There are 2 main cell types which make up the pancreas and are important for its function. The first cell type is exocrine cells. Exocrine cells make up exocrine glands and ducts. Exocrine cells secrete pancreatic enzymes into the pancreatic duct, which aid in the digestion of food. The second cell type is endocrine cells. Endocrine cells make important hormones like insulin and glucagon. These hormones are secreted into blood vessels, which help control blood sugar. Of the 2 cell types, exocrine cells make up the majority of the pancreas, whereas endocrine cells are only a small percentage.
Now I'm going to talk a bit about some diseases involving the pancreas. Pancreatitis refers to inflammation of the pancreas. It can be acute or chronic, and it can have various causes, such as alcohol abuse, infections, and certain medications. Basically, digestive enzymes build up within the pancreas and start to digest the healthy tissue, causing inflammation. Some common symptoms of pancreatitis are pain, jaundice, and low-grade fever. Pancreatic cysts are abnormal fluid-filled growths in the pancreas, which are often benign. There are various types of these cysts, including serous cystadenomas, mucinous cystadenomas, and intraductal papillary mucinous cysts, or IPMNs, of which there are 2 types, main duct and branch duct. Most of these cysts are either asymptomatic or their only symptom is pain. However, if not removed, they often have potential for malignancy. The picture here shows these types of cysts and where in the pancreas they're normally found. Pancreatic cancer is one of the top 10 leading causes of cancer death in the United States, and this is due in part to the fact that it's often detected in its advanced stages. The 2 main types of pancreatic tumors are adenocarcinomas, which are found in the exocrine tissues, and neuroendocrine tumors, which are found in the endocrine tissues. Some common signs and symptoms of pancreatic cancer are abdominal pain, unexplained weight loss, physical weakness and lack of energy known as asthenia, and anorexia, or lack of hunger. Today we're going to focus on pancreatic adenocarcinomas, as they are the most common type of pancreatic tumor, making up 85% of cases. These tumors are also the most deadly type of pancreatic cancer. This type of tumor is found in exocrine tissues, and it is gland-forming, meaning that the tumor grows tubes which invade other tissues such as blood vessels and healthy pancreatic tissue. As discussed earlier, this type of tumor commonly evolves from benign pancreatic cysts or lesions. Some of the most common causes are PAN-INS, which stands for pancreatic intraepithelial neoplasias, and IPMNs, discussed previously. These lesions are microscopic, so they're not seen in routine imaging. However, over time, the lesions lead to further damage and subsequent remodeling, and this damage and rebuilding cycle can often lead to neoplasms. This figure shows how the cells of pancreatic adenocarcinomas create a microenvironment for themselves that allows them to proliferate and evade the tumor's surveillance function of the body's immune system. For example, these masses have few blood vessels running through them, so healthy cells cannot get the oxygen and nutrients that they need to survive. Additionally, cancer-associated fibroblasts in this region send signals to tumor cells to stimulate growth, as well as immunosuppressive signals to suppress the immune system. These cells also modify their metabolism to take in more glucose, glutamine, and macromolecules to support hyperproliferation.
Non-modifiable risk factors for pancreatic cancer include age, sex, race, and genetics. The majority of cases are found after the age of 45, with the average patient being 70 years old. Men are more likely to develop pancreatic cancer than women, possibly due in part to their higher rates of smoking. African Americans are also more likely to have pancreatic cancer. The reasons for this are unclear. but other existing health disparities likely contribute. One major genetic factor that is associated with a higher risk is a mutation in the PRSS1 gene. Now we're going to talk about some of the risk factors for pancreatic cancer. The risk factors on this slide are considered modifiable. Use of tobacco, smoking or otherwise, increases the risk of pancreatic cancer by 25%. Chronic pancreatitis, discussed earlier, is another risk factor, along with obesity and type 2 diabetes.
In the United States in 2020, there were 57,600 new cases diagnosed and 47,050 deaths from pancreatic cancer. It was the 11th most common cancer, and over a period of 2010 to 2016, pancreatic cancer was found to have a 10% 5-year survival rate, meaning that 5 years after being diagnosed, 10% of patients were still alive. This low survival rate is due in part to the difficulty in detecting the disease. Early symptoms are not very noticeable and are often attributed to other issues. By the time the cancer is detected, the tumors have often metastasized, which means that they have traveled in the bloodstream and relocated to other tissues, making the cancer significantly harder to treat. Only 11% of patients present with local disease or cancer that has not metastasized. However, even among these less severe cases, the 5-year survival rate is still only 39%. Resection, or surgical removal of the tumor, is widely considered the only viable treatment option for pancreatic cancer. However, due to the nature of the advanced disease, fewer than 20% of patients are surgical candidates. Chemotherapy is used as an adjuvant to surgery and can increase the survival time in advanced disease, but it is not curative. The mainstay of treatment for pancreatic cancer is palliative care and symptom control. These patients experience a number of unpleasant symptoms, including pain, diarrhea, constipation, GERD, and jaundice. This figure shows the different stages of the disease, from resectable to borderline resectable to metastatic, the different types of treatments and chemotherapies that are used, and the survival rates after these different treatment strategies.
The biggest advocates in pancreatic cancer and pancreatic cancer research is actually anybody and everybody who's interested in the disease. A group of these interested individuals created the Pancreatic Cancer Action Network, which is also referenced as PanCAN. What PanCAN does is focus its efforts on influencing the congressional budget to gain more money for pancreatic cancer and research foundations. One of its more recent goals is seeking more investment in the Pancreatic Cancer Research Program Division of the Department of Defense, which was established thanks to PanCAN in 2019. Additionally, PanCAN helps increase funding for the National Institute of Health and the National Cancer Institute. Here are just some of the other ways you can be a pancreatic cancer advocate. PanCAN's #1 way to fundraise is through a Purple Stride event, which is a year-round fun run/walk where survivors, families, and supporters celebrate and honor everyone affected by the disease. There are 60-plus Purple Stride fun runs held every year around the country, so you can find one near you or even start one through the website. Other ways you can contribute is volunteering at one of these events, including a Purple Stride event. The most effective way to advocate for this disease is to spread awareness and show your government and your friends why you care and why they should too.
Another amazing organization dedicated to the advocacy and research of pancreatic cancer is the Lustgarten Foundation. The Lustgarten Foundation is actually ASIO's national philanthropy effort in which chapters across the country raise thousands of dollars to help fund pancreatic research. Some things about Lustgarten are that Lustgarten is the nation's largest private funder of pancreatic cancer research. The organization was founded by Mark Lustgarten, who himself was diagnosed with pancreatic cancer back in 1998. When the organization was established, pancreatic cancer was still considered an orphan disease, so not much was known about it. Today, their mission is to cure pancreatic cancer by funding research related to diagnosis, treatment, and prevention, to provide information and support services to patients, caregivers, and high-risk individuals, and to increase public awareness and hope for those dealing with the disease. On the Lustgarten website, you can find a number of resources that are available to help patients and caregivers alike. One resource located on their website is a patient checklist, which is designed for newly diagnosed patients to educate themselves about the disease and the next steps following diagnosis. Among these next steps include treatment options, which include surgeries, drug therapies, and also complementary methods. They can also look at supportive care options, which include pain management, coping, and navigating finances, as this might be a completely new realm for some people who have been diagnosed with pancreatic cancer and might not know what options are available to them. If they're looking to get involved with clinical trials, the website does a great job of explaining clinical trials, what they do, and even provides them with a way to find trials for themselves. There are also a number of external resources on the website which provide a comprehensive list of organizations and services that can help them in their journey of pancreatic cancer and are available to patients and caregivers. One of the amazing things that's also located on their website is the inclusion of survivor stories, which are patient experiences written to inspire and educate others. These stories are completely amazing to listen to, and each day they provide more hope and understanding for someone who might have been diagnosed recently with pancreatic cancer.